Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching our earwax removal video today. You can see this really big plug is sitting in this patient's ear. The surface of the wax looks as if it's got a sheen to it. Now that's because we always advise our patients to use a little bit of olive oil in their ears before they come along, just for a couple of days before the appointment. That just softens the surface of the wax, helps us to get a better suction grip. And personally what I found is because it coats the canal wall as well, it does help to slide that wax a little bit better. But as you can see here, as we start to get a grip with the suction tube, it's just moving the front end. So there is it's quite soft, if you like, this plug. There's a little bit of sort of texture to it, so it's more like this clay consistency. But as we get the Jobson horn in here, you can see as we get a grip on the top and push through it, it just chicks a huge chunk off the front of this wax, just really starts breaking this wax down rather than getting a good grip. So a Jobson horn works really, really well. If the wax is just a little bit harder, it tends to get a grip on the wax and draws the whole plug out. When it's this much softer material here, it's always a difficult one, this one, because it blocks suction really, really easily. So you don't tend to get a fantastic amount of suction on here, because as soon as you come into contact with it, it just plugs the end, but the Jobson horn is just pulling through it. So we decided we're going to use a combination of the two, which I use quite often. So we'll take the main central core of this plug away with the Jobson horn and then start pulling the sides in then with the suction. Because we've got a little bit more room to maneuver in the center now, it does mean that we tend to get a little bit more of a wiggle and a bit more of a pull on that outer section, which is slightly harder in most of these chunks of wax. You can see the consistency there as we take that out of the ear. So we're just going to keep working our way down. Imagine this is really sticky and it's stuck to the canal wall, so we can't really get the whole thing away until we've lifted all these sides away first of all. So we're just taking that, working it down the canal. You'll see a little bit of dry skin lifting as well underneath it, where it's been stuck to that surface layer of skin. So don't forget, the skin in the ear canal is not static, it moves like a little conveyor belt, but it doesn't move by much, only about 1.5 millimeters per week. So it's a very slow migration of skin. And sometimes when the wax has been stuck to it like this, you'll get this kind of top layer detaching there. The plug itself is quite deep, this next section. You'll see just below the suction tube, you'll see a slightly grayer film. Now that's that layer of skin I was just talking about there. Always got to be careful with that, because it does tend to get stuck in the end of the suction and vibrates up and down really quickly, which is what they call clarinetting, which forms quite a high-pitched squeal, which can sometimes be a little bit uncomfortable for the patients. You always try and gather as much of it as you can into the suction tube to stop that from happening. Now I've introduced a little bit of olive oil in here. This is going to help just to get things moving. It's really sticky, it's really stuck. So that olive oil is really going to work its way down the side. As we're doing this slight wiggle, it's working that olive oil down the side of this plug, and we've got a better chance then of starting to slide this out. You can see it's really starting to loosen a bit now. Got to be careful with this one now. We don't want to break the whole top chunk off and leave a big piece down in that recess, a little valley down in front of the eardrum, because it would make it very difficult to get to, especially with this very sticky wax. It doesn't want to come away easily. So I'm trying to keep the whole thing together as a plug and just wiggle, work on one side, then another side, just very slowly trying to get the whole thing out if we can. If the worst comes to worst and we do break some off, leaving enough down there that we can get hold of that really easily. So we've got a good chunk come away at the top. Just slow this down so you can see it coming away. There we go. And that's the top section. Now I think there is a little bit left at the bottom. Yeah, there you go. You can see as we start to pull this away, we've still got quite a big chunk to work on here. So I'm just going to try and lift this now from the bottom. Let's get it out of that valley if we can. Really start to loosen this away, and then get a grip on the top section. There we go. Wiggle, wiggle, wiggle. Out that comes. There you go. So we just detach it from that recess. I've just realized how much I say there we go when we're doing this. But it's just starting to come away. There we are. And this last little bit's coming away, and at the top, tiny little piece. There is one small bit left, which we'll just get a grip on. There we go, up that pops. You can see a little hair attached to the side of it. Eardrum itself looking lovely and healthy, just a tiny smidge of wax there on the one side, but eardrum itself looking good. Slightly translucent, light reflexes there, lovely pearly, exactly the way it should look. So this is the patient's other ear. Very, very similar story on this. So we've got this dry piece of wax on the outer part of the ear canal here, and then we're going to go back in, and this bigger plug, which is just sticky like the other side, this clay consistency wax. But we're just going to see if we can get this wiggled off the canal. I can see there's a little gap to the top left corner, so let's work it up towards that and see if we can, there we are, see if we can just get that little bit of movement. It started, see how much more movement there is when you get a grip on the front end then. So as it starts to come away, it looks like this whole plug is coming away, carrying on that wiggling motion. Don't forget, it's really sticky, so it wants to naturally stick to the ear canal walls on the way out. So that wiggling is going to help to keep it detached. But that long plug, look at that one coming away. Really, really nice. It's always really nice when they stay together in one big plug. And we'll take a look behind that now. A little bit of dry skin. You can see how thin those little layers of skin we were talking about was just lifting up there. There we are, just tied it a little bit around the entrance. Eardrum itself looking lovely on that side as well. So really, really healthy looking ear canal. Much, much easier on that second ear there. So we'll show you what we've taken away. So this is 1 7/8 of an inch. And I've done inches on both sides. There we are, that's great. So that's 4.5 centimeters, I reckon that is. Yeah, that was specifically for the American audience. They got inches on both sides of the ruler. So guys, I hope you enjoyed that video as much as I did voicing it over. And as always, guys, take care of yourselves, take care of your ears, and take care of one another. And fingers crossed, I'll see you again on Monday. Have a great weekend, guys. Bye, everyone.